What happens after miscarriage? While some women don't experience any symptoms of miscarriage, most will have some bleeding and spotting. Other signs of pregnancy loss include pain in your back or abdomen, white-pink mucus, passing tissue or clot-like material, and loss of pregnancy symptoms like nausea or vomiting. See your healthcare provider right away if you experience any of these symptoms. He will likely conduct a fetal ultrasound and blood tests to see if the pregnancy is viable. Physical healing after a miscarriage may depend on how far along in the pregnancy the loss occurred. Miscarriages that occur early enough during the first trimester may simply require rest and recovery at home, which allows the pregnancy to expel naturally. Some women take medication like Cytotec, misoprostol, to speed things up, and others undergo a dilation and curettage, D&C, to excavate the uterus. A D&C is most often used if the woman is bleeding heavily without effective passage of the tissue, incomplete miscarriage, says Jennifer Jolly, MD, Assistant Professor of Maternal Fetal Medicine at the University of Washington in Seattle. It's also used for missed miscarriages. During the procedure, doctors will dilate the cervix and remove the contents of the uterus with suction and scraping tools. You can expect postoperative pain, bleeding, and cramping for several days. How long do you bleed after a miscarriage? Whether you had a natural miscarriage or a D&C, you'll continue bleeding as your body expels the pregnancy. Bleeding after miscarriage will be heaviest within the first several hours, and it'll probably contain clots and fetal tissue. The flow will eventually lighten up, and it will go away completely after 1 or 2 weeks. Always use pads, never tampons, to control the bleeding. Your period after miscarriage. After a miscarriage, your monthly cycle may look different than usual. For example, you might have heavier bleeding, irregularity, or spotting. However, your period should return to normal before 2 months, says Dr. Zev Williams, MD, PhD, Director of the Program for Early and Recurrent Pregnancy Loss, PEARL, at Montefiore Medical Center and Albert Einstein College of Medicine in New York. That's how long it takes for your uterus to return to its previous state, and for the levels of pregnancy hormone HCG to drop. Having sex after miscarriage? If you had a natural miscarriage, you can have sex after about 2 weeks, assuming your OB/GYN gave approval at your follow-up appointment, says Angela Chaudhary, MD, a gynecologic surgeon and assistant professor in the Department of Obstetrics and Gynecology at Northwestern University Feinberg School of Medicine in Chicago, Illinois. Women who had a D&C might experience more intense bleeding, and they'll need to wait longer to have sex after miscarriage. Getting pregnant after miscarriage. You may not feel ready to conceive another baby just yet, and that's more than okay. But whether a woman has experienced a spontaneous loss or required surgery, most physicians recommend waiting 1 to 2 full menstrual cycles before attempting another pregnancy in order to allow full physical healing and hormonal rebalancing. That said, according to the ACOG, ovulation can occur as early as 2 weeks after an early miscarriage. Always get the green light from your doctor first before trying to conceive again, says Jonathan Schaffer, MD, an assistant professor of obstetrics and gynecology at Ohio State University College of Medicine.